What is the preparation for jaw surgery like? Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. इस वीडियो में बताऊंगी कि अगर आप एक्सप्लोर कर रहे हैं अपने लिए जॉ सर्जरी, देन व्हाट इज द प्रिपरेशन टिल द टाइम ऑफ सर्जरी, व्हाट इज द टाइमलाइन एंड हाउ मच टाइम डज इट टेक टू गेट बैक टू वर्क. सबसे पहले इज आइडेंटिफाइंग वेदर यू आर अ कैंडिडेट फॉर जॉ सर्जरी और नॉट. ये इवन दो इट्स entire topic in itself, but to tell you in very short, if you notice any kind of inequality in your jaws, upper और lower jaw में कोई भी size में difference लगता है, shape में difference लग रहा है, asymmetry लग रही है, number one, then you're a candidate. Number two, if to correct this discrepancy of the jaws, you have already undergone braces but have not found the results, then you're a candidate for jaw surgery. Or if you have undergone any other kind of surgical procedure or non-surgical procedure, but still the problem of size or shape persists of either of the jaws, then you're a candidate for jaw surgery. The next is preparing. What is the first step towards the preparation now that you have decided to do jaw surgery? I think the first is deciding who will be doing this jaw surgery. It's very confusing nowadays as a patient to understand who will do a jaw surgery. You will find dentists, dermatologists, plastic surgeons, ENT surgeons and maxillofacial surgeons all doing some kind of procedure on the face. For jaw surgery, which involves mobilizing and cutting and surgically performing something on the jaws, the most specialized branch for this is an oral and maxillofacial surgeon. So the second question to be answered is who will be doing your jaw surgery? Your jaw surgery should be done by an oral and maxillofacial surgeon. Third, where should the surgery be done? A lot of times, especially for patients या आप में से कोई, if you are staying in a tier 2, tier 3 city and you have done your research, you want to go to, let's say, a slightly bigger city or a metropolitan city to do the same procedure, there are few things you need to keep in mind. It would be best if the jaw surgery is happening in your own city. If it's not, if you want to avail services of a slightly more renowned doctor or somebody with a very good setup, choose a place where A, travel to and back to your hometown is very easy. B, a city which has direct access in terms of airport or railway stations. And also, if possible, you should have some relative or some friend who can be with you during that entire duration. Fourth, what are the tests or scans or x-rays, whatever, what do you need to do before the jaw surgery, before you actually end up going for the jaw surgery? Well, very, very ideally, you should have already met your doctor either over a video or a physical consultation before you actually land up for the surgery. Assuming that is done, you should have the following with you: a CT scan of the face, a lateral cephalogram of the face, a PA cephalogram of the face, and OPG X-ray. These are in terms of X-rays. Then blood tests and certain other tests which are required for your pre-anesthetic checkup. That will include a complete blood count, your LFT, your KFT, your bleeding time, clotting time, PT-INR, viral markers, a chest X-ray and ECG. If you suffer from some other kind of disease or you're on some other kind of medication, additional tests may be asked for. Next, if you're doing jaw surgery, maybe a virtual surgical planning was done for you. If a virtual surgical planning is done for you, then another prep for the surgery is to go through that planning with your doctor, sit with them, see the before-after simulation of the surgery. If you're not happy with what is being done, communicate that to your doctor. Let's say that is also done. Then you need to have an appointment before the surgery in which either braces or brackets are placed or some kind of banding is done. The banding may be in the form of eyelid wiring or it may be in the form of arch bar fixation. Lastly, reach the hospital wherever you are at least 2 days prior to the surgery so that you can even have a physical meeting with the anesthesiologist and they actually do a full verification for you. Most jaw surgeries, for example, a single jaw surgery, the recovery period is around 4 to 6 weeks. if there is a double jaw surgery involved, your recovery period might extend up till 2 months from the surgery. If you have any other questions, any doubts, please reach out to me directly on the phone number given below or DM us.